Before I start a new topic, I want to go back to something I've talked about before, um, about really abuse of the system and abuse of people. I don't know any better way of saying it, and it's unfortunate, but I saw a patient yesterday in the clinic who's in her mid 80s, uses a walker to get around, doesn't really walk very far at all. And I saw her as a second opinion. Her husband is a long-time patient of mine. They live, in fact, he still comes and sees me once a year to check on him, but they live about an hour away from Dallas. And they went to a local podiatrist who's part of a larger group, essentially of podiatrists and interventionalists who are put together kind of a referral system, which I don't have a problem with. But the obvious goal is to do more procedures on people. And it drives me nuts, I'm sorry to say. But essentially, this podiatrist had seen the patient who was getting just regular foot hygiene, which is fantastic. And on physical examination, the patient did not have easily palpable pulses. And the podiatrist did some non-invasive testing. I don't think that's unreasonable whatsoever. And the patient was found to have peripheral vascular disease. Again, not surprising given the age and the history. But the patient did not have claudication symptoms. Remember, this is an 80-something-year-old woman who uses a walker to get around. She did not have claudication symptoms. She did not have wounds on her feet. She did not have rest pain. She did not have critical limb ischemia. And because of this funneling effect, where the podiatrist and the interventionalists have are in the same kind of group, this patient was funneled into this channel of getting interventions done at an office-based lab, or at least it was recommended to her. And she said quite plainly she did not feel comfortable going through this because she thought, well, why am I going to go through this procedure? It scared the hell out of her, quite frankly. And so she was referred to have a procedure done on her circulation, on her arterial circulation. And again, I've taken care of her husband for years. They came and saw me. They drove an hour to see me. And, I talked to the lady, and she had absolutely no symptoms of claudication. Again, she wasn't that active. Uses a walker to get around. In fact, unstable on her feet. So she really doesn't walk long enough to get any claudication symptoms. And she had no wounds on her feet, sleeps fine at nighttime, no rest pain in her toes, no history of wounds on her feet, nothing to suggest critical limb ischemia. I didn't see the non-invasive studies. Doesn't matter. Okay, she didn't have palpable pulses on her feet. I couldn't feel the pulses on her feet. Irrelevant. This patient had asymptomatic peripheral vascular disease, and she's being recommended for interventions. And the problem with this is, number one, it's morally bankrupt. Number two, you subject an asymptomatic patient with peripheral vascular disease to intervention, and they have a high risk for limb loss eventually. So I, kind of allayed her fears. I said, look, yeah, you have peripheral vascular disease. You don't need anything done. You don't smoke cigarettes. It's highly unlikely you're going to get worse because you don't smoke cigarettes. In fact, she wasn't even diabetic. And so I said, you do not need anything done. Do not go through this procedure. And she, after a long discussion, she said, okay, great. I left her with, if you develop signs and symptoms of critical limb ischemia, I didn't say it that way. But I said, if you develop pain in your toes at nighttime, wounds on your feet that aren't healing, call me. And then we'll talk about it. So anyway, she's fine. I'm going to check on her annually. But it's a really disturbing trend to me. And I don't think anybody's really talking about it. We talk about doing amputations and, people losing limbs. That's a trap. That's horrible. There's people getting amputations that should have limb salvage procedures. Absolutely no doubt about that. But there's also people having procedures done that don't need them done. And that to me is a travesty. That's a travesty. And then screening, I'll do a video on this. I don't care anymore. I'll do a video on the number of screening tests that are done by insurance companies in patients' homes, and screening tests for peripheral vascular disease using QuantaFlo, or what's called QuantaFlo device, or a flow check device, screening people for peripheral vascular disease for reasons that are completely financially related as far as I'm concerned. But I'll do a video on that one too. I'd like to get back to telling people about vascular surgery, like I've been trying to do, to allay people's fears about what we do for a living, because it is scary. I mean, people come to my office that have high blood pressure immediately, and I always tell them, like, don't worry about your blood pressure in office. What you're at home is a much better measure of blood pressure. So vascular surgery is scary stuff to most patients. But when you do stuff like this, that makes everybody look bad. And anyway, I'll do a discussion on these screening tests for vascular disease. I'll tell you what the right screening tests are to do, the wrong screening tests are, never to get an intervention if you're not symptomatic, when to get an intervention. But then also I'd like to get on with other topics in vascular surgery, temporal arteritis, talking about other conditions that we treat, and so you have a better understanding of what you're going through before you make a decision to go through a procedure. I'll update you on my condition, my mitral valve regurg. My mitral valve, again, is not working real well, so I've had a couple of opinions on it, and I'll kind of talk about that sometime.